Good morning, everyone, and thank you for being here for this important announcement this morning. I'd like to thank Police Chief Hyatt, Fire Chief Runn, Dr. Branch of our Health Department, and others for joining us this morning and for their unwavering dedication to fighting this ravishing and terrible opioid epidemic. I'd like to thank the County Council for approving the Opioid Strategy Coordinator position in our budget this year. And I'm grateful that soon-to-be former Delegate Eric Bromwell will be coming on board to lead our strategic charge in Baltimore County to address opioid addiction. I also want to express my sincere gratitude to Tony Torch and the Torch Foundation for their hard work to raising awareness, fighting stigma, and saving lives. Thank you for turning heartbreak into action. And your efforts and the numerous sponsors you have collected today have made these signs possible. So thank you in advance to all of our sponsors, who I'll let Ms. Torch speak about later. I'm also pleased to be joined by Senator Klausmeier, who's been a big advocate and lead in this fight. As you know, opioid addiction is a serious problem in our country, in our state, and here in Baltimore County. It's a disease that does not discriminate. Regardless of income, race, zip code, most people have been affected by it in some way. And we cannot continue this trend of parents losing their children, children losing parents, siblings losing siblings, and loved ones losing loved ones. So we need to work more towards public awareness, compassion, and solutions to the opioid addiction crisis. That's why today, in partnership with the Torch Foundations and our sponsors, we've erected 8 new overdose awareness signs, just like the one behind me, in 5 different locations across Baltimore County. There are 2 signs here at the Public Safety Building in Towson. There are 2 signs at the Dundalk Police Precinct, 1 at the Pikesville Precinct, White Marsh Precinct, and the Woodlawn Precinct. These sign locations were strategically selected for the purposes of high visibility, and we need people to understand the gravity of this epidemic. I want to thank Councilman Marks as well for making the connection to the Torch Foundation on this effort. All of the signs, like the one behind me, will display the number of overdoses, the number of lives lost so far this year, and equally as important, a telephone number that people can call for assistance. The Baltimore County Police Department will use their data to update these signs each month, and I want to thank Chief Hyatt again for that partnership. As you'll see behind us, so far this year, we've already had 780 overdoses in Baltimore County. 185 of those have been fatal. My hope is that when people see these signs, they'll be reminded, and they will remember that these numbers represent people. 185 mothers, fathers, sons, daughters, co-workers, neighbors, residents of Baltimore County, our people. So again, thanks to Councilman Marks, Senator Klausmeier, and their partnership for connecting the county with the Torch Foundation. Tony and her team have worked tirelessly to collect the sponsors needed for each sign. So we want to thank Chesapeake Medical Staffing, Interconnect Services, Maryland Addiction Recovery Center, Hope's Horizon, and Amadeus Health for their support in helping to bring this awareness to Baltimore County. Now, I'd like to note that these signs are just one part of our larger effort to strategically combat this opioid crisis in Baltimore County. I mentioned our opioid strategy coordinator earlier, but in addition, we've convened an opioid working group in partnership with the Hopkins Bloomberg School of Public Health. That group has brought together experts from the county and the region to engage our residents and stakeholders in a process to make recommendations about how we can continue working together to address addiction and save lives. A draft of that working group's report will be released for public comment very soon. Finally, this Saturday, August 31st is Overdose Awareness Day. And I encourage everyone to talk to your family and friends about this crisis, volunteer or donate to an organization that's helping in this fight.
For me, as a mother who lost a son to an overdose, these announcements always usually come with bittersweet thoughts. Children should be holding the hands of a parent as they close their eyes for eternity, not the other way around. The Daniel Carl Torsch Foundation, specifically John Torsch, my oldest son, began efforts for these signs with the former administration in the very early days of 2018. But it didn't gain any speed until after Mr. Olszewski was elected, and with the strong support of Councilman David Marks. I'd be remiss if I didn't mention that many of the achievements in prevention and treatment of opioid addiction would not have happened as quickly as they had been if had it not been for the legislative leadership of Baltimore County Senator Klossmeyer and Delegate Bromwell. And not just for our county, but across the state. These signs are meant to bring awareness, to show that this crisis, this disease, knows no boundaries of race, age, gender, or zip code. In 2010, when Dan died of an overdose, there was 115 total drug and alcohol overdoses in Baltimore County. And you'll see by the sign today, we've had 185 fatal drug overdoses so far. So here are my hopes. I hope that a father and son will ride past the White Marsh precinct and start a conversation about addiction. I hope when two friends are walking up the street here and they see the sign, they'll start the same conversation. This is all going to be helpful. It has to happen to erase the stigma that so many of us, family members, and especially those that are struggling and even into recovery. Note that the signs also include lives saved, because that's the other number that you see. What I also hope is finally one day that we'll have to tear the signs down. Wouldn't that be great? An important fact to mention, that there were no taxpayers' dollars used for this project. Everything was held, it was very important to hold everything in the county. From the printer, John Bruning from Speed Design, and of course to all of our sponsors. Amatus Health, as the county exec was saying, Chesapeake Medical Staffing, Hope's Horizon, Interconnect Services, and of course the Maryland Addiction Recovery Center. While we have done all of this, there's so much more to do. And so we're just grateful for all of you to keep spreading the word. And from the bottom of my heart, for the sponsors especially, I'm grateful for your partnership and your friendship.
As I stand here today, I'm grateful for our partners who made it possible for us to reach out to our communities and share our overdose death numbers around the county. I also stand here gravely saddened by the fact that these signs represent the hundreds of lives that have been lost in the opioid battle. Now that I know that the struggle against this epidemic is far from over. And with a brutal fight like this, injuries, cuts, bruises, and sometimes even death are inevitable. But I do not want to see another life displayed as a statistic on these signs. Therefore, in concert with today's sign unveiling and International Overdose Awareness Day, which is Saturday, August 31st, I'm asking our residents to reach out and join in our preventive efforts. Reach out to help us bring our overdose numbers down. If you are suffering, or if you know someone who is facing an opioid addiction, reach out by calling 410-88-REACH. That's 410-887-3224. Reach out and prevent another untimely death. Thank you.
We are all too familiar with the suffering and loss that occurs as a result of the abuse of illegal narcotics and opioids within our community. This crisis, which impacts every community, requires our police officers to be multidimensional in their approach. We can't simply be enforcers of the law. We are often the first response to overdose cases and must be empathetic caregivers as well. Our officers carry naloxone and have used it 135 times so far this year. Together with our partners in the fire department and other local agencies, many lives have been saved in Baltimore County. On each occasion that we respond to an overdose, we are encountering someone's family member, mother, father, sibling, child, or even friend. And we always hope that our efforts ultimately lead towards treatment and recovery. Our enforcement efforts will continue until this crisis no longer exists. Law enforcement takes our role very seriously, holding those accountable for contributing to the deaths of others. We aspire for these signs to raise awareness and serve as a reminder about the broad impact of addiction. It affects all of us, regardless of what community we reside in, our socioeconomic status, or any other factors. Every neighborhood in our county is affected, as are far too many families. We all share a responsibility in fighting this health crisis together. Thank you, and I look forward to continuing to work with my colleagues and other partners in confronting the issues of narcotics and opioid abuse.
On behalf of the fire department, thank you to County Olszewski for the opportunity and calling attention to this extremely serious problem, and the Torch Foundation for leading this effort. Our firefighters and EMS providers are on the front lines in the opioid crisis. Every day, we see the heartbreak and devastation that's caused by this opioid abuse. Every day, we do our best to save people caught up in this epidemic. Since January 1st, our personnel have administered 1,250 overdose Narcan life-threatening situations. People in all ages in every community effort rung in the socioeconomic ladder. We have transported more than 1,000 overdose victims to the hospital. We recognize successfully dealing with this opioid patients far more involves more than just medical treatment. Hand-in-glove efforts with our partners in the health department can operate in a holistic approach. We refer every patient who receives Narcan to the health department peer services recovery specialists. We partner with the health officials to identify and refer those who are overdosed and want help with their addiction. We share information based on our response profiles with the health department so that they can give at any time the information that is needed to the communities to help with assistance. I also want to mention a new initiative that we expect to launch in a few weeks. It's called Narcan Leave Behind. There are cases where it is helpful to leave a dose of Narcan behind for the patient's family. We're in the process of training our personnel on how to identify those cases and how to instruct the families in the Narcan use. Winning the battle against opioid crisis abuse is an ongoing effort that's going to take coordination and significant investment from all stakeholders. Baltimore County can count on the fire department to be committed to be an important partner in this fight.
First of all, I want everybody to move that way. I want the public to see the number, the call for treatment, resources, and support. We've lost the lives, God rest every one of the souls that we have lost, but we have to move forward. And as a state legislator, I vow to work with my partners here in Baltimore County and with the state to move forward and work on this whole problem that we have. It is a crisis, and it still is a crisis, and we will be working to address the crisis.